afternoon, everyone. Can you just quickly confirm that you can hear me? Okay, I see David nodding. All right. Okay, good afternoon, everyone. Thank you for joining us and welcome to the 8th edition of Insights, a public health webinar hosted by eHealth Africa. My name is Johanna Rögele, and I will be your host for today. I am the Strategic Engagement Lead at eHealth Africa. So again, thank you all for taking precious time out of your afternoons, most likely for most of us, to join us for this event. I want to share up front a few words about our Insight series itself. The objective of this webinar series is to foster meaningful conversations with and between professionals and key stakeholders in the public health space at large. And today I have the honor to speak about a topic really close to my heart as well, and discuss how digital tools can strengthen blood management systems in particular. So with us today are professionals with years of experience in the integration of technology into the public health supply chain in line with EHA's mission. EHA's mission, and you can read much more about that on our website and across our social media, of course, is to build stronger health systems through the design and implementation of data-driven solutions that respond to local needs and provide underserved communities with tools to lead healthier lives. So on today's topic, on the topic of blood management and for context in general, just a few words about the topic. The supply of safe blood products is essential for the day-to-day functionality of our health systems around the world. And deficiencies in the supply chain become acutely problematic during and after a crisis. The ability to increase incoming supply and to manipulate existing stock in response to an emergency is therefore crucial for crisis management. So our blood value chain professionals, whom I have the honor to introduce to you shortly, will give us expert insight into how the use of technology, digital tools, and data applications helps to improve accuracy in the recruitment, testing, processing, and distribution of safe blood products. We will also discuss how these technologies and tools facilitate real-time visibility and accountability along the blood value chain so that key stakeholders can make data-driven and informed decisions for better service provision to populations. So without further ado, as our first panelist, I would like to extend a very warm welcome to Michelle Vermeulen, who is the head of marketing and public relations at Western Cape Blood Services in South Africa. I've had the pleasure to work with Michelle for some years now and know her as a qualified public relations practitioner with 18 years of experience in the field of PR, marketing, and events management. She's been working at Western Cape Blood Services for 7 years, and her passionate and strong technical focus is on the process of blood donation. And Michelle thus has a particularly keen interest in how technology shapes the future of blood donor recruitment. So welcome, Michelle, and may I please ask you to say or indicate a quick hi, whichever one you prefer.
Hi.
Hello. Okay, thank you. And next up, I have the pleasure to introduce Dr. Mohamed Farouk, who is the Managing Director of the Africa Society for Blood Transfusion. Dr. Mohamed is a medical doctor with deep expertise in patient blood management, epidemiology, and research methodologies. He specializes in transfusion medicine and the transplant of human tissues and cells. He's been a member of the Egyptian National Blood Transfusion Services from their inception, while serving as technical advisor for the Swiss Red Cross on blood safety projects. And he further serves in the advisory committee of the International Development of Transfusion Medicine Institute in the Netherlands. That's a lot of words. So welcome, Dr. Mohamed. May I also please ask you to say hi.
Hi, everybody. Yeah, my pleasure to be with you. Thank you.
Thank you. All right, so for our next guest, I'm honored to introduce Emmanuel Nenede, who is the head of planning, monitoring, and evaluation at the National Blood Service in Ghana. Emmanuel has worked at NBSG for over 14 years and in different capacities, including as a biomedical scientist and research officer. Further, he's the study manager for the Community-Based Communication Intervention Protocol, or CCAT for short, of the Blood Safe research program funded by the National Institutes of Health And he's also a passionate member of both the African Society for Blood Transfusion and the International Society of Blood Transfusion. Emmanuel is a health tech and data enthusiast with broad leadership experience, especially in the area of implementing information tech solutions for the improvement of blood services. So we are grateful to have you. Welcome, Emmanuel, and please say a quick hi to the audience. I think we will hear from him later. All right.
Hi, everyone.
Oh, hi. There you are.
Great to hear from you and great to be here to contribute.
Hi, Emmanuel.
Yeah.
Thank you. And then last but very much not least, I am very happy to introduce my dear colleague, Francis Ayo, who is a technical project manager in the informatics department at EAD Africa. Francis is responsible for engaging key stakeholders in using agile methodologies to elicit requirements and documentation to ensure the high quality delivery of work packages and facilitating user interface, architectural, and IT infrastructure designs. Since 2010, Francis has been leading cross-functional IT development teams in the telecoms, electricity, financial, and health industries. So welcome, Francis, and please a quick hi from you as well to the audience.
Thank you, Joanna. Good afternoon to everyone. Pleased to be here.
Good afternoon. Thank you. All right. So now that we know our panelists and have gotten a quick introduction, at this point, I'm happy to ask all of you in the audience that we're so excited to have you, and please make sure to use the Q&A section of this webinar. So preferably not the chat box. We have our wonderful communications team working in the background, but if you can use the Q&A section of this webinar to post your questions as the webinar progresses. I will pick up the questions with the time that we have left at the end of this webinar to inquire the panelists' responses to them. So if you want to direct the question to a specific person on the panel, please also indicate that. And all the questions that we cannot get to today, what we've done in the past webinars as well is that we collect them, we have our panelists answer them, and then we post the responses on our website afterwards. So keep an eye out for that if your question wasn't answered, and apologies in advance, we might not have time for all the questions, but please do post all your questions that you may have along the way. Also, for everyone's information as we go, this webinar is being streamed live on our EAD Africa LinkedIn page. So if that's of interest to you, if you ever want to visit us on LinkedIn, please feel free to do so as well. So now I am very pleased to welcome another dear colleague, EAD Africa's Deputy Director of Programs and Impact, Dr. David Akpan. May I please request your opening remarks, David?
Thank you, Johanna, and welcome our distinguished guests and participants. Welcome to the 7th edition of Insight webinar. I think it's quite exciting to see the progress we've made with this platform. So interestingly, today we'll be discussing, I think Johanna has done a very great work in the intro on describing the value of technology in the blood management system. Quite an interesting piece of conversations, and on the panel today, we have seasoned professionals who are going to share with us very great insight into what technology has been able to do in improving blood management systems within the different location of the work that they do, and I mean around Africa. We're definitely going to employ that all the participants be able to learn from all the experiences and the vast work that have been done by our different panelists, and they're going to share with us quite interesting insight, and that's why it's called Insight. So we're going to gain a lot, learn from all of this, and the primary goal is to ensure that if we have an opportunity to operate or possibly run a blood management system, you will definitely infuse some of the learnings from this particular conversation. And very, very well, feel free to also share ideas, and that's why this is also a platform to do so. And we're very much open to responding to questions as much as we can, and then we look forward to what the conversation is going to bring out. Thank you very much, and enjoy the rest of the session.
Thank you, David. And yes, very open always to suggestions for further topics as well, as we want to keep this series going. So again, thank you to the panelists. Thank you to the audience. I already checked. We have over 100 people already joining us. So we'll be happy to see this number grow as we progress. And this brings us to the panels, and to the questions, starting with inquiring about the panelists' more general or overall experience with the advantages and benefits of using technology in their work in the blood management sector. So maybe we can do a little roundtable before we go into more specific questions related to your individual sets of expertise. So maybe we can start with you, Michelle, handing over to Dr. Mohammed, Emmanuel, and Francis to kindly share with us your experiences with integrating technology in the recruitment, testing, processing, and or distribution of safe blood products, and what advantages you have seen for your work as a consequence. The floor is yours.
Thank you. I'll start off. So technology has played a major part in the way we recruit donors at the Western Cape Blood Service, or WCBS in short. Those donors who opted to receive SMS communication from us receive SMS notification when they are due to donate. We also thank our donors for donating blood via this system. When we are in crisis and our blood stocks are low, the use of SMS has proved to be very effective to ask our donors to donate urgently. We also use what we call a smart SMS, a specific targeted message to donors over and above our semi-automated system. According to a recent survey that we've done to our donors, this is proving to be a very effective tool. We've also embarked on using WhatsApp for our plasma donors. These conversations are manned by our customer service officers and ensure that a relationship is built with our donors who donate on a regular basis. Through this medium, we are able to provide a very personal service to our donors, and they use it freely to communicate with us. So social media plays a big part in our everyday communication to all donors, with a skew towards our young youth donors who are interested to hear from us on platforms such as Instagram and TikTok.
Thank you, Michelle. And I think, yeah, as everyone can hear, I mean, your specialty is in PR marketing and then donor recruitment, and we'll hear much more about how technology has impacted that field in particular. Thank you for sharing your experience, and I'll hand over to you, Dr. Mohammed, for your angle on this topic.
Okay, thank you very much. Thank you very much, Joanna. I will focus here on the use of my experience on the use of the blood management information systems in donor mobilization and scheduling. And actually, my latest experience was in a war conflict zone, where not only mobilization of donors became challenging, but also scheduling of donors to show up for donation at a specific time, so that crowds of donors are not under risk of booming, or they show in numbers exceeding the operational capacity of the blood establishment, or numbers exceeding the real clinical needs for blood, which will result in waste of blood later. So using the blood management information system and the messaging application, we managed to make the blood establishment work and run the operations in a way highly comparable to the model of just-in-time, this model of the supply chain that's used in many production industries. Accordingly, with the help of the blood management information system and the messaging application, blood donors showed up only at the locations that needed to recover their blood stocks, and with a maximum of 2 donors at any given time inside the blood establishment. And really, this was a unique experience to understand how blood management information system can be helpful to enhance the efficiency of the blood establishment. Yeah, thank you.
Thank you, Dr. Mohammed. And I think it's really interesting what you touched on with the crisis or combat a situation, particularly, which just shows how many more layers of, crisis management, or how multifaceted, how multifacetedly the blood management sector is affected by these crises. So I think with that, Emmanuel, if I could hand over to you to describe some of your experiences with the advantages and benefits of tech in your work.
Thank you very much. So I would like to touch on my experience on the advantages of using tech tools in blood services. I want to concentrate in the area of donor identification and management. So we introduced a blood safety information system, and this system has helped us to be able to properly identify our blood donors. In that, through some data integrity rules that we have infused into the development of the system, it enforces that we capture the minimum information that is required for us to accurately identify blood donors, and then associating them to their previous history, which is within the system. And so because of that, we are able to tell who is who and who that particular person is, and then how we should provide a particular service for the person. Essential in the system design is the capability to properly identify or exclude blood donors based on their infection status and the testing results. And this feature allows us to be able to link any blood donor who is affected or one way or the other infected with a TTI. You're able to link that person to further care and treatment services. And so basically it is one of the things that tech tools has helped us, just making sure that we are able to identify donors, we are able to link them to their records, and that also aids us in managing them very well and linking them to care that they might need in their line of donating blood. Yeah, that is what I think my experience is briefly. Thank you.
Thank you, Emmanuel. And I mean, it's very interesting that we're actually also logically starting at the beginning of the blood value chain, not kind of really with all of the intricacies around blood donor recruitment and blood donation. Francis, what is your experience in this area?
Right. Thank you, Joanna. For me, it has been a great journey developing system and capabilities for the stakeholders within the blood transfusion chain, where we have a one-stop system that helps to provide visibility and accountability across the various actors. For instance, you as a stakeholder, you want to reach out to donors, you are looking for a way to create that capability that will enable you seamlessly engage them and generate interaction that over time we make them a one donor become a donor multiple times, right? Become a recurring donor. And you want to also in the chain see that they easily get to donation centers, be it mobile donation center or fixed donation center, and quite easily be attended to, and bleeding takes place and you have a donation product out of there, and the logistic people are able also notify and they come pick it up and take it to testing center, and processing team also do their bit of the work. And afterward, the product generated is moved into blood bank and shared across various blood bank that services or attend to hospitals within clusters, distant area. And if there are third-party logistics as well, they have access to move those products from where they are currently housed, into where they are needed to carry out transfusion. And when there are a transfusion and there is adverse events, you also have that visibility as a stakeholder to see the number of people who have some sort of adverse event, and you're able to do a look back where you can trace concisely where the blood product that was recorded with adverse event is coming from. The tools that were used, the material that were used in the donation, testing, and processing, the healthcare workers that were involved. You are able to do a root cause analysis and tracing, and eventually have a robust reporting system. Yes, these are currently ongoing strides, and collaborating with all the stakeholders within the space has helped us to come up with something very unique that we believe over time, when it is implemented and adopted across the divide, it will bring the blood transfusion chain that visibility, that accountability that we require. And leveraging on our geospatial capabilities as well, you can tell when a driver or a logistic person is picking up a donation from one point to another, or a product that it needs to pick up from one point to another, to ensure that a crisis is managed and it does not become one of such morbidity statistics, right? So these are capabilities that information system is doing, and we are in forefront of this across the nation at the moment. Thank you so much, Joanna. Over to you.
Thank you, Francis. And I think this is very interesting, as we'll be speaking more concretely around the topics of visibility and accountability along the blood value chain. And I think that's that's something that's a topic dear to your heart. So we'll come back to you on that. I believe that, you know, having heard what you all had to say about the advantages and benefits of that technology has brought to your work, or how it's made it easier or safer or more efficient, I think what would be interesting to kind of get a snapshot on, or a few words per panelist, for you all to describe, and maybe we can stick to the same order. Michelle, it's your lucky day. You're going to have to go first again. Whether you can describe what the challenges in these processes that the technology was now response to, what they were before the integration of technology. So, you know, what did these things look like, and what did it take also maybe in terms of time resources to complete a given task or step that is key to your work, as opposed to how much time or resources that is taking now?
So Joanna, being from marketing and PR, I mean, for me, I'm already way looking to the future. So in answering your question, I have to look to the future. So for us, technology is evolving so quickly that we must stay abreast with the latest trends and how to reach our donors. So I'm sure, as we all know, Generation Alpha, for us, the next generation of blood donors are on our doorstep, and we need to ensure that we are ready for them. Although we at WCBS have developed an app to get information across to our donors in terms of where to donate and to find these clinics, we are currently evolving this to include the donor questionnaire as well, and therefore creating a more user-friendly experience and ultimately making it easier for our donor to donate. Completing the questionnaire online, we are hoping that this saves time for all our donors. Donors who would have been deferred at the clinics could now be deferred online, avoiding going to our clinics to be deferred, and therefore also making the process quicker for our donors attending the clinic. Our online questionnaire is just one step in many that form part of our Pulse system. That's our internal system that we're developing, a vein-to-vein system that can give donors, patients, and clinicians an overall better experience and real-time information, saving that overall time from when a donation starts to when it reaches a patient. And then also we are looking at the back end of social media to ensure that we reach our donors via the use of Google Analytics, drawing on stats on where we can reach our donors and ensuring we get maximum traction on all platforms, also ensuring that we recruit donors more effectively and therefore saving that time in the process.
Thank you, Michelle. I will hand over straight away to Dr. Mohammed.
Thank you. For this issue, I can recall that I have been involved at one stage of my career heavily in testing of donated blood for transfusion transmissible infections. although I'm not very old, but I started this when we were using the manual testing systems, where we were like doing the pipetting of samples manually, doing manual map for the numbers of samples, and then transcripting the results into paper, and then releasing the results to the other department who will identify the infected blood units and segregate them and so on. Moving forward, we had automated machines, but they were not interfaced with the information management system. So we needed again to print the results manually and start to verify the result, having two persons reading and verifying the results, and then releasing them to the blood processing department to release the non-infected blood units. However, the breakthrough was when we had introduced the interface of the testing machines with the blood management information system. So at this point, the release and the revision and everything related to the release of the results became automatic, and we eliminated all possible human errors, transcription errors. We reduced the time the time needed to do all this paperwork and the release of the results. And also this enhanced the traceability. When we have any problem, the traceability backward also was enhanced much by introducing this technology of interfacing the testing systems to the blood management information system. Thank you.
Thank you, Dr. Mohammed. And I mean, probably you don't have that on the top of your head, but are there numbers for the human error elimination, like reduction?
Okay, I don't have the number itself, but I recall that maybe per day we would have one error. Okay. Yes. But we could manage it because we installed many layers of human revision. Okay. So one person is doing it, and then another person is reviewing, and then a third person is doing a third check, and then at the blood release department, it's being revised again for the fourth time. So you can imagine, to eliminate one error, we have 4 persons doing this revision process. It's really a waste of resources.
Yeah. Okay, super interesting. Thank you. Emmanuel, I'm handing over to you.
Yeah, thank you, Joanna. So prior to introducing our technology, it took us a lot of time and effort to confirm the identity of blood donors, especially those who are probably not due to donate or ineligible to donate at a particular time. In some cases, we had to rely on word of mouth, making several phone calls, doing a lot of checks, and other non-routine inquiries, which created undue delays for both workers and blood donors. And in situations where the identification is not properly done, we will end up collecting blood which is not efficacious for the patient, or blood which is infected. And all of these contribute to increase in wastage of resources. Also, there were significant lapses and delays when you have to go to the lab. Close to what Dr. Farouk said, we're getting the TTI results from the laboratory and then manually linking the results to a bulky list of blood donors to see who might need further care, or who might need counseling, or who might have to be prevented from donating again. And so all of these things were actually making the work difficult, and it made the time taken to be able to complete some of these tasks very laborious. And so these were the things that trying to streamline some of these processes were one of the things that triggered us to introduce the technology that we are currently using. It has a lot of improvement to be done yet, but at least we are able to reduce the time taken to do some of these processes and reduce the wastage, and at least get blood which is efficacious for our patients. Thank you.
Thank you, Emmanuel. And I suppose, I mean, I'm not the expert here, but as these systems and processes mature, the gap between before and after in terms of resource wastage will only grow. Thank you for sharing. And then I will hand over to Francis.
Right. Thank you once again, Johanna. Yes, for us, we are excited at the opportunities that information technology present to us to be able to support the varied stakeholders within the transfusion chain with capacity that takes care of one key pain point, which is silos. Each stakeholders, each actor doing their activities in silo, and it takes significant time, and that leads to inaccuracies where you are trying to put a patient record together in order to arrive at a decision, a support decision that we improve patients' experience and everyone within the chain. Now, designing systems that help in collection of data that had once been a silo, bringing them into a one-stop shop system so that instant access could be provided from where donor recruitment is done. Now, a donor is easily able to see schedules of donation institution, right? Gone are the days where the storm locations and donors are blind to those activities that have been planned or pipeline to happen around their areas. For instance, I made a mention of this to a colleague that if I am having a birthday celebration, I decide to, as a form of social activity, organize a blood donation, with my friends, right? Technology now has made it possible for me to check the schedule or reach out to donation centers and inform them that I have 10 friends that would like to donate blood, and thereafter schedule a visit, either mobile visit where the center will come to our location, or we can drive in one vehicle to the location and carry out donation seamlessly, thereby increasing availability of blood donations and product eventually. So we have made a system that makes this quite easy, and this brings efficiency and visibility across the chain. Now, also, you will be interested that for third-party logistics, for instance, there is a particular zip line that uses drone to deliver blood products to hard to reach locations, right? Currently, it has a scale to Nigeria, so that when there are crises, you are able to easily take products from any location to any location B, from point A to point B with less hassle, within record time. With that, you save souls, you save life, and everyone is happy for it. These are system capabilities that ICT has brought to the fore for us, and we are very excited that this is happening, and we are looking forward to further collaboration to ensure that all user story and personas that make the work of the relevant team efficient is delivered to their hands, so that you have all your work in your hand. Wherever you are, you can access report, dashboarding that helps to come up with intelligence that you can use to enhance activity of each actor. Thank you. Over to you, Joanna.
Thank you, Francis. And I really appreciate that you framed the growth path that we have in front of us in terms of integration as a potential, and you sound very excited, less than a bottleneck. Also thank you for the subtle suggestion what to do with our friends on our next birthday party. So I hope everyone took note. Organize a blood donation run. All right, so thank you to the panel for this first round. I also saw that there are, questions coming in the F&A section. Some of them directly addressed to a panelist, the others more general. Please keep them going. We love to read them, and we will love to answer them. So this kind of takes us a little bit more deeply into addressing more specific tasks within the key processes that make up, the vein-to-vein process or the blood value chain. So I'd like to address these questions more directly to to one of our panelists, starting with, to everyone's surprise, with Michelle. From your perspective, what role has technology played in fostering specifically visibility, accountability, and transparency in the blood transfusion chain?
So visibility for us is key to recruiting donors. If we are not visible, donors will not donate. We ensure that we are visible on all social media platforms and ensure that we reach the right target audience while we are on that platform. Using social media tracking tools available, we know which type of messages to target on different platforms to ensure we gain maximum exposure. Social media is no longer just Facebook, Twitter, and Instagram, but it's an integrated process of gaining valuable insights for us into our donors so that we can adjust messages based on what our donors want to hear. Technology has evolved so much that it allows us to expand our branding here in the Western Cape. An example of this would be that within shopping malls where we host blood donation clinics, we now have various options to choose from to advertise to keep us visible. Electronic lockers, electronic billboards, shopping screens add endless possibilities for branding. Through these types of technology, we are able to even have our messages displayed on certain high traffic petrol stations. And these messages can be swapped and changed within minutes, affording us the opportunity, again, to adjust our message based on our blood stock need. We are also able to allow our donors the opportunity to contact us and interact with us on different platforms, ultimately where our donors feel comfortable. We've recently found that through regular electronic surveys, our donors are willing to share information with us, which gives us valuable insights to use to recruit even more donors and ensure that the donors we have keep returning to donate blood. We leverage easy wins for us on applications such as WhatsApp statuses, where we can give donors and friends and colleagues exact information about us and where we will be hosting clinics. We also have great relationships with our media partners, and via WhatsApp, we are able to send out press releases, get our call to action into the media urgently, and also raise awareness as and when needed. We also have opportunities here to keep visible, to remain visible, to brand on our media partners' websites and ensure that on these platforms we can drive traffic through to our WCBS platforms with the goal of creating awareness and ultimately driving potential donors to our clinics. In terms of accountability, according to the 2021 South African Hemovigilance Report, no transfusion transmissible infections were confirmed, which reflects the effectiveness of the state-of-the-art testing technology in place across the South African blood service platforms. Another platforms we use is in our quality assurance. We have started to move away from paper-based SOPs and moving towards an electronic system with this as well. By implementing lean throughout the company, we are also fostering a culture of accountability as well as improvement on all levels. As a nonprofit organization, transparency has always been on top of our list of priorities. So technology assists us to track our collections and measure it against our targets. And our performance is well documented in our annual reports, which is published on our website. So through technology, we've also ensured that access to us and information is readily available. If some of you might know, we even hosted our first annual general meeting on Zoom, which is partly probably due to COVID, but this technology ensured that our stakeholders had access to us and to crucial information. So technologies ensure that we continuously build relationships with our donors, clinicians, patients, as well as other stakeholders. As I mentioned a little bit earlier, we are in the process of developing an integrated system at WCBS called Pulse, and we are in the final steps of completing phase 1, which is upgrading our clinic staff front-end process. The next will be to elevate our donor experience by allowing an electronic questionnaire. We are embracing technologies, and we believe that the possibilities here are endless.
Thank you, Michelle. I'm always so impressed when I hear you talk about your work because, first of all, yeah, you like it so much. And second of all, I think the not a lot of people, or I'm going to speak for myself, I didn't know how much work goes into branding and PR and marketing for blood donor recruitment before I met you, and how much thought. And so thank you for sharing these experiences, and also for talking about all the different ways, you know, all the different technologies that you're using. Because like you said in the beginning, I think many people immediately jump to, you know, Instagram or social media, but there's so much more that can be high impact in terms of creating the visibility and also the branding that you need. So thank you for that. All right, so I think I have a question for Emmanuel up next, to ask you to kindly share your experience of how technology has improved last mile delivery of blood products to facilities. So really talking about the supply chain there.
All right, thank you, Joanna. So for us in Ghana, I think I would like to touch on the introduction of the use of drones in the delivery of blood products. That's not just the physical drone, but it's backed by vital technologies, digital technologies like automated traffic management systems, real-time weather forecasting, and geolocation, as Francis mentioned. This has really improved the delivery of blood products to health facilities, more especially to remote facilities and hard to reach facilities, at times over rivers, over large forests, and over mountains, where hitherto you couldn't have used vehicles to reach those areas. The use of drones have allowed us to reach some of these facilities more quickly than we probably could do before the introduction of this technology. What the digital technology part of the use of the drone does is that it allows the whole delivery process to be managed with precision and accuracy. In the sense that from the moment a blood product request reaches the distribution center, the transmission of that information is automated with technology, apps, and integrations. That is from the management of the order through its fulfillment, and the tracking of the order and the delivery of the products, and then the final dispatch to the precise facility or location where the product is needed. This sophisticated technology has really helped us to improve accessibility of blood products to areas where it previously took virtually days to get certain blood products. And so we could, due to our differences in infrastructure, we could have some places being able to produce certain kind of products that might be needed in other places, but it will take a lot of days to get those products to those areas. But then with the introduction of these technologies, at least we are able to get it to them as quickly as possible, especially in emergencies. And so when there's an emergency and they will need these products, they will not need to travel very far to wherever it is produced. But through the use of the drone, it gets to them as quickly as possible. And I can say that just last year in 2022, through the use of the drone, we have been able to deliver about 3,000 blood products to such remote areas, which I think that we might have lost these 3,000 lives. And so that is quite something significant and quite something important that we appreciate the use of the drone and then the other digital technologies that the drone works with. And so in summary, technology in the blood delivery space has ensured, first of all, information integrity. And so because the information is automated, the information is not changed at a particular time. And so the right information pops up at the right time. It has also reduced delivery times. And so we are able to save more lives within a shortest possible time. And then one of the key things that we used to face, it is improving it, even though we have not been able to get it all right, but at least we've been able to improve access to blood products, especially to people in the remote areas and the hard to reach areas. Thank you.
Thank you, Manuel, for sharing your experience with that, and yeah, at the very end, also touching on the issue of access for underserved populations that are especially, vulnerable, and especially in the crises, during and after crises, as we had talked about in the intro. So thank you for sharing that experience with us on last mile delivery. And also, I think it was interesting what you touched on in terms of information integrity being ensured in this way. Francis, I will come to you so that you can walk us through your assessment, or from your point of view, basically how the use of technology has improved reporting and performance in blood establishments.
This hitherto. Yeah. Hello. Can you hear me, please?
You are back. Yes, we hear you now.
Oh, okay. Yes, we see that patient record are updated every now and then, and it also in the blood transfusion chain that also happens, right? Then, if such updated information are not shared among players or among stakeholders within record time, the patient could suffer. And this will lead to communication breakdown, and they could, as a result of that, have medical errors. And we also notice that there is this gap in analysts being able to assess quality of the healthcare around blood transfusion. But then we have seen that visibility in this instance entails that you know who is donating at whatever time. Yes, we are conscious of private data, who have access to those data, that the data of the donor and the data of the patient as well, of a donor who has some health issues, for whom is a donation will not be useful, right? We want to protect those information from being open to the public or to the wrong hands, right? So these are kind of architectural alignment that happens in the design of the system, so that only the allowed people, or the people that have been indicated to have access to them, will be the one have access to such information. And you can also talk about scheduling. In scheduling, you are talking about traceability and collection of data. Now, how much of flexibility is available? Convenience. We're talking about user centricity. Here, that is the donor. Without the donor, the whole chain is broken, right? So for you, as a stakeholder, you want to have some metrics, some reporting metrics that will help you take some decision and guide your thoughts in what you would do next. For instance, you want to see the number of registered donor by gender, by age, or perhaps by location and the donation center where those donations have happened. You want to see the number of blood testing center or the number of tests conducted per month, right? You want to see whether there was failed test, whether the number of total past tests, the blood group, the gender, the location where those are happening. You want to, as well, as a procurement or finance team, be conversant with the consumable that are used at the various facilities. The facility here are: one, donation center, testing and processing centers, blood bank. You want to also see visibility. You want to also have visibility to the hospital. What consumable are they using to fulfill blood donation? A blood transfusion request. You also be interested in demands. How many number of transfusion are coming from the hospital, and how many are you able to meet, right? And I also mentioned about adverse events. How many of such adverse events do you have? And when adverse event is reported, the system also has this capability to give you a clear-cut view from where the particular blood donation happened and who made the donation, the equipment or consumable that were used, and the healthcare workers that were part of the process, from donation, testing, processing, and storing, even retrieving it, transporting it from one location to another. Perhaps the cold chain is not working optimally, this as well may affect the effectiveness or the potency of a blood product. And when it is transfused, you could begin to have issue. And also, we will be concerned about logistics, the KPI or the metrics around here. What are the consumables in stock? How many have been issued? The facility type, the kind of blood that is in stock, by wastage, by blood group, by blood type. Are they expired? Are they still potent within their end of life or life cycle? You know, so you have these, and this form a bulk of the reporting, visibility, and efficiency it brings into the system. And when stakeholders have access to this kind of information, and to also guide feed activities so that nobody goes to the feed blind, just running eta-scatter, or using the usual or current scenario where paper-based are used, right? If you recall what Michelle stated, that they are also working on a phase 1 where even questionnaire will be administered electronically, you know, where you have questionnaire filled manually. There is a data entry officer who will be capturing that. And as human, you cannot take error from his work out 100%. But when these are captured real time in the field, perhaps in a mobile, what is coming in is clean, what is coming as data is true, and you can even question or query the data sources, right? And you can quite easily integrate to other existing systems. That is another beautiful part of it. And our work is that of open source. So the APIs are open to the public to leverage on, to rapidly develop related solution or to consume and come up with further capabilities for the chain. And these are key pain points that technology has helped to make possible. Thank you. Over to you, Joanna.
Thank you, Francis, for giving examples and also showing what the context is around real-time investigation of performance issues and along the value chain, and how technology has helped with that or is helping with that. Just a quick note, I think this was part of my job at the beginning of the webinar, but I did not announce that. We will close the panel at the hour, or do our best to do so. So we'll move into the last rounds of questions and try to keep to keep those short and sweet. And then the Q&As actually move into the minutes after the full hour. So if possible, bear with us because I see we do have a lot of questions collected. So the panel will close at the hour, and then we'll discuss or bring on the questions afterwards. All right, so I think, Dr. Mohammed, we haven't heard from you in a long time. So related to the insights provided by the other panelists, from your point of view, how has the use of technology improved overall data-driven decision-making by key stakeholders in the sector? And I think you gave a great example, in the beginning, how something like this can be very political. So I want to just open it up to, for you to speak about the experience in terms of overall data-driven decision-making in the sector.
Yeah, okay, thank you very much. So, of course, we all know that technology is not limited only to the data management and the blood management information system. It has also the layer of operational technologies that are used for automation of blood collection, testing, processing, and storage. However, the focus, I think our focus here is mainly on data management. And since we are saying this, data management technologies and blood management information system provide an immense amount of data. And data means better decision making. So having all these data, all decisions are more informed and accurate. And even having some advanced tools such as data analytics, data mining, etc. Using these tools, we can automate some processes, some of the activities like responding to consumer or customer and making some computerized decisions. Data management systems allow faster decision-making process because large amount of data is processed and summarized within maybe few seconds, and then the decision maker can have a better view on the best decision to be taken. Also, data management system can provide us with the future trends of a certain activity in a blood establishment or at the level of big blood transfusion service, future predictions about the use of blood, the need for different blood components, the changes in donors, demographics, and donors mobilization trends. So even having such data management system will allow to plan for the long-term in the future and the operations of the blood establishments. And finally, in this area, I think with data management system, we became like a small village, and maybe many blood establishments can be interconnected with the help of technology. And whenever like a national decision is required, then it will be easier to reach this decision having data collected from all across a given country. So I try to be short to keep the hour. So thank you.
Yes. Lovely. Always appreciated by the host. Thank you so much, though, because you still managed to show the breadth of the impact that that effective data management has in the sector. And I think especially your looking at planning and prevention of shortages and of crises. This is very essential, because then you might not get into this crisis mode as gravely as without the planning tools available to you. With that, well, we're almost at the end or closing this webinar in terms of the panelist discussion. I would say that, and with the sake of time, we'll do a last round robin in the room, and we can stick to our preferred order, with Michelle maybe giving us a 1 minute or a 30-second rundown or your major pain point. So basically what we want to look at is, with all of the potential and the benefits that we've talked about, each of you, from your point of view, what is the one major bottleneck, the one major challenge that in the adoption and scaling up of technology for blood management from vein to vein that persists? And if you have a recommendation how to fix it, we're happy to hear it.
So from my side, I think the obstacle here is manpower, time, budget. Most of us, it's everyday running of the blood service, and we require that staff to operate, develop, test. So implementing new ways of doing things require that knowledgeable staff to develop and invest in new ways of doing things. For me as well, there might also be a slight resistance to change, especially from, I suppose, the older staff that's been around. They're used to doing things the same way. And I think one way of resolving that is planning. For us, planning is crucial. I would recommend rather do smaller projects over a longer period of time, but ensure when something is implemented, it's working, it's tested, and of course, it is a real need to change. Thanks.
Thank you so much. I'll hand over to Dr. Mohammed.
Yeah, in a quick note, it's not like a bottleneck, but I think it's like a concept that many blood establishments that I have visited, they try to reinvent the wheel when it comes to information technologies. They try to do everything from the scratch. So it's a huge project, impossible, needs a lot of resources, needs a lot of resources, financial, human, expertise, and so on. But I don't think we should follow this approach. I think the best way is to start where other ended. Okay, so many information systems are available for the blood establishments. They can be too much advanced, they can be less advanced. However, we don't need to reinvent the wheel and face the obstacles of deficient resources. We can start from where other ended. Thank you. Thank you. And as a health tech organization, you're speaking
from our heart as well, not to reinvent the wheel in terms of any solution across public health space. Yes, thank you. Emmanuel.
Thank you very much. I think one bottleneck I would like to touch on is when we use the wrong approach to adapt these technologies. Most of the times we tend to adapt the technologies that don't fit the needs of our users, especially those who are not technology inclined. We tend to dismiss their inputs because we think they don't know technology. But I think that since they are the main stakeholders, and eventually they are the people who are going to let us see the actual use of the system and the value that it brings to our processes, we need to not dismiss their inputs, else they will misunderstand what the technology is for, and then they might misuse it. And so I think that when we are adapting these things, we should test and learn together with all our stakeholders, especially those who are using, and then we should apply principles of human-centered design so that we are co-creating these technologies with all our stakeholders. And in that way, they will trust the system and will create trustworthy and effective system that will be used to its fullest advantage. Thank you.
Thank you.
I think I love this last part of Emmanuel's response, where we could create solutions, right? It is very essential that solutions are user-centric. Take, for instance, instead of having a text field where end users of that solution will have to type in words, right? All you need to do is to have a drop-down instead. Take, for instance, to add to that, the list of states in Nigeria, right? Instead of asking an end user to type in Kanu or type in Abuja, you want to have that as a drop-down so that, one, it saves time on the part of the end user, and you are guaranteed as well as the database team, or you are guaranteed about data consistency, right? So yes, instead of just reinventing the wheel, it is very important that we collaborate. It is very important we co-create. It is very important that ultimately we deliver results that are user-centric and help to fuel the technological advances that are bound in this particular space. Thank you.
Thank you so much. Yes, thank you so much, Francis. And yeah, for connecting your response as well to Emmanuel's response. I couldn't agree more. And yeah, I think this actually takes us, I mean, it is actually everything you just said is a segue into the questions that came up. So I just want to say with a delay of 4 minutes that we made it to the end of the panel questions. Yeah, before we go, of course, we will now address your questions. At this point, I'd like to also extend a huge thank you, though, first to our brilliant communications and help desk teams at Health Africa, who are always the backbone of whatever we're doing that looks nice. And they have been managing absolutely everything around this event in the background. So thank you, communications and help desk teams, and you know who you are. So thank you for your support. And with that, I will move over to the Q&A section, and I see that the communications team again has also kind of copied the things over that came in through the chat. So I will just open it up with a question that was directed concretely to Francis, and that was, and sorry to catch you off guard now, but how do you handle the challenges of blood demand in conflict zones in the Nigeria context? Not an easy one.
Okay. Yes, I have also already responded to that, but I could just take a minute. The system has this feature that is dedicated to handle this particular pain point. Yeah, it is able to switch to emergency mode. In switching to emergency mode, you have, for instance, adjoining blood banks are kept on alert about a current crisis situation for which they must be ready, than usual to respond to blood demands requests. Also, the use of drone technology makes it easy now to transport products to conflict zone, right? As against where you have to revert back and say, apologies, we are not able to, we don't have access to bring products to you. Just imagine the 3,000 that Iman mentioned that drone technology was able to service for last year. Imagine losing 3,000 people where drone technology does not exist. So it is easy to transport products to such zone, and importantly, or that what may interest you too, donors are kept on alert of a crisis via all communication channel. And with this, you are able to increase availability of blood products. All these actions are data-driven, which the system provides. Thank you. Over.
Thank you, Francis. And I hope this answered your question in the audience. There are also a few questions that came in, and I think they might be, they're not directly addressed to you, Michelle, but maybe you're the best position to respond to them. So they were really around how well social media has been used to encourage donors to maintain a healthy lifestyle, I guess, so that they're, you know, regularly eligible to vote, not eligible, but to donate. And then how have digital tools improved numbers in terms of voluntary donations?
Yes, I think in the answer to the first one, we do regular information sessions on social media to tell people about health. I think that is part of our donor criteria. It also depends, so we use that statistics to come out and see what kind of messages we have to put out on social media. So if we see that the HB is a bit on the lower side in certain areas, we target that on social media. We give people information perhaps on what to eat to increase. So we tend to do that. If we see, we also tell people about our deferral periods as well. So yes, we do encourage people on social media to have that healthy lifestyle. And then also based on your second question, we've seen an increase? Definitely. We've seen a rise in the amount of people who are following us as well on social media. With our messaging as well, we can see where with our messaging, if the youth is starting to following us, and in direct translation as well. I think social media, especially through the COVID section where people didn't have access to go to places that much, we could really interact with people on social media. At our lowest point, we were sitting at about, I think, active donors on about 61,000 active donors. And in a question of, at the end now of the period, we back to about 71,000 active donors, which for us is a mass amount of increase, and getting that message out and recruiting new donors.
Thank you so much, Michelle, for responding to this. And I see that there were a few questions about the system itself that Francis was talking about, in particular the biscuit system. And I think, Francis, you have been answering those in the chat. Those were quite technical questions. So I hope this these written answers were satisfactory to the person who raised the questions. I think since this is something that is so dear to our hearts in general as a topic, I do want to come back to two questions that if we can make an impact today on responding to those, I think I would, walk away happily. And that's one is an educational question asking what the criteria for blood donation are. I mean, we cannot speak for all countries in all of the world, but maybe, again, Michelle, this might be something that you'd be happy to respond to either live or in the chat. And then, well, maybe live better for everyone if you can. And then Dr. Mohammed, I think something that might be, really square in your field of expertise. The question came in the current, health climate. Do you personally encourage blood transfusion, considering the outbreak of all kinds of diseases associated with blood? So either one, I don't know if you want to.
You want me to kick off? I'm used to kicking off first, so let me start.
That's it now.
Donor criteria. So quickly, in South Africa, you have to be 16 years and older. You have to be younger than 75 to donate. You have to weigh 50 kilograms or more to donate, and you have to be healthy on the day of donation. So you can't have any colds and flu, and you need to lead a sexually healthy lifestyle. So for us, in a nutshell, that is the basic donor criteria.
Thanks so much.
Okay. Yeah, I think now it's coming to me. Yeah.
Yes.
So there is a concept that says the best blood transfusion is the transfusion that didn't take place. Okay. So when we do any blood transfusion, there is always a risk that there's something will happen, transmission of a disease that we don't know about that can be transmitted through blood. However, this does not mean that we don't do blood transfusion because of outbreaks or pandemics or whatever, because there is no other substitute to transfusion of blood to treat some medical conditions. Okay, so the clinical decision maker, do you want to let this patient die or have like long-term disability or whatever, or you try to do the safest blood transfusion as much as you can. Okay, so I think the answer is to provide the safest blood transfusion as we can. So no, I cannot say I encourage blood transfusion during our parade or I don't encourage. It's a clinical decision by the physician who value the benefits and the hazards of the blood transfusion for each single case. Okay, and as I said, the best transfusion is the transfusion that we did not do, and now the new approach in blood transfusion is patient blood management, where we try to minimize as much as we can the need for blood transfusion by doing some procedure pre-operative, during the operative, and post-operative. Okay. So this would be my answer to this question.
Thank you, and I appreciate your your candor in talking about or the slogan, let's call it for lack of a better word that you just used, and the openness, and also the hint at this new approach of patient blood management. I'm almost sad I have to give closing remarks because this was a good one, a good thing to close on both of these last points, Michelle and Dr. Mohammed. And then Francis, I see that you were really active answering all the technical questions in the chat. So I appreciate this, because that's where more of the, nerdy stuff happens. So thanks for that. And with that, I think we're at a good time to kind of soothe into the afternoon for everyone. So again, thank you for all of you on the panel. I appreciate you, or we appreciate you taking the time to get prepared with us and to be here today with us. And also to our wonderful audience, all of your questions going into all different kinds of directions. That's always really exciting to read. I also read some of your wonderful comments saying thank you and giving your feedback already in the chat. So that obviously helps us to keep going. So yes, thank you for the very insightful discussion. And our next Insights webinar, I'm sure you'll see it all over our social media, but maybe to mark your calendars, is on February 22nd. So we'll be very happy to see you then and there. And before you go as well, as always, if you do anything online, they're going to ask you for your opinion. So if you do have a minute, please take the time to fill out the survey that shows up when you click on ending this webinar, just to help us at EHA to get better at what we do, and continue this series. And now I'll hand over to David again, I believe, to give us his closing remarks, and then we can say goodbye to everyone.
Thank you again, Johanna, and thanks to our wonderful guest panelists, and of course the participants who had stayed this far. I think it was quite an interesting conversation. I had a few pinpoints around efficiency, improving efficiency through, what technology does in terms of improving efficiency. Talk about deduplication, enabling system interoperability, and a good number of things around trying to ensure that we improve in terms of resource management, right? Those were good highlights, and we hope that our participants have been able, and as indicated, learn from the session. We hope we continue with, building stronger systems to improve the blood transfusion or management sector or space. And we also look forward to more conversations around the public health, how we can also improve public health response to the benefit of the general population. So thank you for being part of today's session, and we look forward to having you in a subsequent session. Thank you.
Thank you, David. And thank you, everyone. I hope you all have a wonderful rest of your day. And we'll see you soon, or the very least next month.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye. Have a good one.
Bye.